July. While it's not noticeable in the mainstream media, the bill itself has sent a shudder, for want of a better expression, down the spine of those already concerned about the road the NHS has been put on by successive Tory and Tony Blair governments. So you yourself, Dr. Bob Gill, you're an NHS doctor and campaigner, and you're clearly concerned about this bill. Before we go into some details on that bill, maybe if you could outline what damage, if you can put this as briefly as you can, if that's possible, what damage has already been done to the NHS by the Americanisation or the privatisation by those successive governments?
Yeah, so as you rightly point out, this has been a 4-decade-long stealth privatisation. Because it's so treasured by the British public, successive governments have had to do this surreptitiously. They've started by outsourcing non-clinical services like cleaning and catering back in the 80s. They introduced the internal market, supposedly bringing free market discipline into the NHS and driving up efficiency. Well, we know that's a total scam. But that laid the framework for repurposing the NHS ethically and taking it away from a public service ethos into more of a business culture, a corporate culture. So you had this bloating up of the management and administration of the NHS, diverting more and more money away into administration. And then we had the Tony Blair government, which doubled down on the internal market. For the first time, started to outsource clinical services like elective surgery under the narrative of the private sector helping us lower waiting lists. Well, they could have done that in other ways by increasing public capacity. And I suppose the other major thing Blair did was to saddle the NHS estate, land and buildings, with PFI debt. Now, PFI debt, people frame it as a mistake. It wasn't a mistake. It was a deliberate saddling of the NHS with private debt, which would get more onerous over time, and then be used as an excuse to flog off land. And PFI also handed over ownership to the private sector. So you had the assets being privatized, you had the market ideology brought in, and in 2012, the Health and Social Care Act made what was a totally phony internal market, which drove up costs and made the NHS more efficient. Well, that was forced into a compulsory external market. And then we had a decade of austerity. All this time, the capacity of the NHS, the number of beds per head of population, has more than halved since the 1970s. We have the lowest bed capacity per head of population compared to all other OECD countries of similar economic status. We have the fewest number of doctors per head in Europe. And by the time we entered the pandemic, we've suffered a historic freeze of annual increase in the budget of around 1% on average over the decade, whereas since 1948, it's averaged about 4%. So a defunded, repurposed, marketized NHS with a huge hole in the workforce, 10,000 vacancies in doctors, 40,000 nurse vacancies. And then we were hit with the pandemic. So this was a disaster waiting to happen. And what the government did in their handling of the pandemic was, rather than learning from the mistakes of all this market ideology, was to double down and accelerate the conversion from the NHS to an American-style insurance-based system.
Okay, so that's quite a bleak picture that you've painted, and it's one I suppose a lot of people might be already familiar with. So just what exactly is this bill, if it becomes law, and given the numbers it probably could become law, how exactly could that make things worse?
Yeah, so the biggest change they're proposing is the creation of new legal entities called integrated care systems. Now, the terminology is deceptive. It's not about integrating clinical services to make them better, because they've spent the last few decades disintegrating clinical services. What they're interested in is integrating the budgets to pull over social care budgets, what's mostly been privatized already, pull that into NHS budgets over time, and pool primary care and secondary care budgets, and give responsibility for control of all that money to an arm's length new public-private entity called an integrated care board. Now, this integrated care board, on the board will be sitting all the private corporations that have been awarded outsourcing contracts over the years. And what most people are unaware of is that this legislation is making legal what has been going on behind the scenes very quietly for over a decade, which is corporations such as the big four accountancy firms, the management consultancies like McKinsey's, the outsourcing giants like Serco. They have all been at the heart of the backroom function of the NHS and working out how they will deal with these budgets. So they've already been in place. This is not some hypothetical threat. The corporations are embedded within the NHS, and what the creation of the new legal entity will do is formally transfer power from government of decision making in terms of looking after populations of patients to this new public-private entity. So that's a massive step. And from all the policy documents and the statements reading between the lines, what an ICS will be in all but name is based on the US Medicare, Medicaid system, which is dominated by big private insurance companies like United Health, the world's biggest private insurer, where the government, the taxpayer, puts in the money, but the management of that money is with a private insurer, and they are allowed to make profit. This is the key. They will be allowed to make profit out of the ICS budget. These budgets will be fixed for a population of 2 to 3 million people, out of which they will make efficiency savings, they call it, and deliver value. Well, to me and you, that means profit for shareholders and executive bonuses. So in fact, in reality, they would have replicated the managed care system, which the Americans are desperate to go away from.
Okay, so there again, a further bleak picture that's been painted here. I mean, of that, the integrated care systems that you've mentioned, I've read before that you've said that it could also, as well as trying to make profit through working on their budgets and so forth, that could also lead to hiring of less qualified staff, selling off of NHS land. What way do you think that would affect the public? I mean, even if it's not obvious how that would affect the public of hiring less qualified staff in order to save money.
Well, we have to look at the model that we are following. So if you go to America, the number 3 cause of death in America for hospitalized patients is medical error. That is the end result of this downskilling trajectory. There are 2 things that the private sector used to deliver healthcare, is to downskill and to task shift, to go away from professionalism and to break up clinical tasks into smaller and smaller, more straightforward tasks on the surface. But if you are only dealing with a bit of the patient at a time, then it increases the room for error. Now, when you have larger room for error with a patient care, that can lead to preventable patient harm and patient death. So by putting in charge, or putting, instead of a qualified doctor, for example, if you put in a physiotherapist or a nurse who has far less training, far less experience, then their blind spot, their clinical blind spot increases. So their area of unknown unknowns increases. And when an atypical patient presents, which is outside of their clinical experience, and it's presenting with something serious, then that patient risks harm. And, you know, if you, again, comparing to America, despite them spending twice as much money per head of population as we do, they have worse outcomes. They don't live as long. More of their children die in young age. More of their mothers die in pregnancy. These are hard endpoints that show how well a health system is functioning. That is not a model any rational person, ethical person would follow. Yet our consecutive governments have been following that. So the managed care system is a way that the American profit-hungry corporations have devised to almost collude. Insurers who manage the budgets and providers collude to deny care to sick patients. That's what it boils down to. And you're saving on the wage bill, as I pointed out, but the biggest thing is the denial of care. So you risk stratify the population, you use their medical notes and various other algorithms and computer software. You identify the people who are undeserving in your eyes because you want to maximize profit. They're undeserving of care, and you block their access to expensive hospital care. And how do you do that? Well, you set up an algorithm that blocks their access. You close services. You take away their GP surgeries. You present them with less qualified people, and you shut their A&Es. So there's nowhere for these people to go. And, you know, the outcome is obvious. So people will be dying of serious illnesses before they get to hospital.
And that denial of care, I mean, that's one of the most worrying things. There's several worrying aspects, but that's indeed one of the most worrying aspects of an American system or any system. How would they, I mean, we're probably looking into the future, or maybe we're looking across at the United States, but how would they or how do they get away with such practice?
It's a good question. Well, you know, they're very litigious in America, and the lawyers get involved if there's a big pay packet at the end of the day for them. If you have a dead patient, generally speaking, that's not a good income for the lawyers as much as a disabled patient. Now, if you have the wherewithal and the energy to fight for yourself or a loved one, it's quite a big task because you're going up against very rich institutions who have very well-paid lawyers. So you're facing an uphill struggle. The regulation is very weak, and the government is very disinterested. The government in America have more or less given control of healthcare provision over to the private sector with minimal regulation. So, you know, you have a David and Goliath battle. You have everything stacked against the patient, who in their most vulnerable state does not have the capacity to successfully fight what is being done to them.
And if we just briefly look at the 2012 Act, and in particular this section called Section 75, which some people want to repeal and other people want to keep. As best I understand it, Section 75 means that certain processes have to be put out to tender. There's good and bad in that. Out to tender means it could end up the private sector, but at least if it's out to tender, we get to see what's going on. Do you think Section 75, is it overtalked? Is it really important? Or is there something better needs to be in its place instead of what we have?
So what we need to do is to renationalize the NHS. But until we renationalize the NHS, Section 75, none of us want any tendering out. But at least with Section 75, it's open, it's competitive, and it can be scrutinized and it can be challenged. By repeal of Section 75, what you enable is recreating the emergency legislation that the government used to outsource the whole pandemic response in multi-billion-pound crony deals that are only coming to light now. There has been blatant corruption, as found out by the government's own, I think it was the Public Accounts Committee or the National Audit Office. revealed that there was a VIP fast lane within Downing Street, that if you had connections to the Conservative Party, you were 10 times more likely to get a contract. Do we really want that system for the marketized NHS? I don't want a marketized NHS, but if we have a marketized NHS, until we renationalize it, we must not repeal Section 75, because that will allow secretive deals to be made. And it will also enable, this is the more worrying thing, it will enable the private sector monopoly within the NHS. And, you know, I referred to the creation of this managed care system replicating Medicare, Medicaid in America. By repeal of Section 75, that will enable one company in particular, who are very well placed, United Health, to effectively gain monopoly control of all NHS budgets in England.
Okay, quite stark. Now, where in all of this are the voices that we need to be hearing? Obviously, we need to hear from everybody, but where's the Labour Party opposition? Where's the medical opposition? Why aren't people jumping up and down? I mean, if, as I said at the start, if you looked at the mainstream media coverage, it's kind of like reform, which is a dubious enough kind of a word. But where are the people that need to be screaming about this, or are they screaming and they're just not being heard?
Yeah, well, I'm afraid it's a reflection on our wider democratic system. So the vast majority of the print media are owned by multimillionaires, often tax exiles, who have a particular political leaning. The privatization of the NHS suits their interest. They're invested in these things. You know, that ideologically they're wedded to that system. So they are not going to report what's going on in the NHS. The BBC, although it has a mandate to inform the public, all the key appointments are made by government, and they are not going to appoint anyone who's going to allow real editorial freedom to report what's going on in the NHS. So the BBC has played a key part in covering up the privatization. In fact, the 2012 Act, it just swallowed the government press release and presented it as handing control to the front line. Well, what utter nonsense that was. So the BBC are let down. The commercial broadcasters have a financial interest in the privatization of the NHS because they will be advertising for these private insurers. They will be advertising for these outsourced companies, companies like Specsavers, who have taken over a lot of audiology services that are either contracted out or no longer exist in the NHS. So there's a commercial interest for these non-BBC broadcasters to keep quiet about what's going on. And then you have our opposition. Well, what can I say about the opposition? Other than they sabotage their own electoral chances on 2 occasions. So a significant proportion of the Labour Party, I think the vast majority of the PLP, were gunning for their own leader, who refreshingly dared to mention the P word when it came to NHS. He mentioned privatization, he mentioned the threat of a US trade deal, and he paid a very heavy political price. But the current shadow front bench, from what I have heard, I hear nothing that reassures me that they are genuinely interested in defending the NHS. Why should they be? Because a lot of them haven't spoken out about what's going on, haven't said anything about the Labour track record 97 to 2010. So what are we left with? Well, we're left with the representative bodies, the medical professional bodies, but I'm afraid, once again, the leaderships are disconnected from the interests of their members, as we see in many organizations in this country. The BMA, the Royal Colleges, the RCN, and I believe Unison, all rubber stamped the white paper on which this bill is standing. So they, essentially, the leaderships are either ideologically aligned or they're being co-opted in some way. So they're not doing their job. So it's down to individuals to much extent, but what is probably most perverse is one of the leading campaign organisations for the NHS. Keep our NHS public. Never criticises the BMA. Often falls on the wrong side of the argument, in particular Section 75. I checked this the other day. On their website, they're still calling for repeal of Section 75, believe it or not. But that is their position. And only today, if you look at their Twitter, social media, they were over the moon that the BMA have released a statement in opposition to the bill. But if you read the statement, it's clear that they're talking about timing of the bill, and they're talking about other distractions. But in the body of the text, they actually endorse the creation of integrated care systems, and they're arguing for greater representation on these boards. They're arguing for a snout in the trough. That's what they're arguing for. They should be calling for a total rejection and renationalisation, and they're not doing that, and they're being backed up by Keep Our NHS Public. So this is of great concern. Now, it wouldn't surprise me if me and you decided to do something totally against logic, morality, and ethics because of our own financial interest and financial interest of our friends, and there was a lot of money at stake. Well, what might you want to do? You might want to make sure you nobble any opposition before you get going. You might want to co-opt where the opposition might come from, the unions, the health unions, the BMA and the Royal Colleges. So that is where we are, I'm afraid. And, you know, we've got our work cut out, but, you know, I'm hopeful that if we present the public with the evidence, if we make it clear to them what is at stake and who is after our NHS, it is American corporations who will be extracting wealth from this country. It will be costing us all a lot more in financial terms, either through taxation or topping up private insurance to replace what is gone from the NHS. On an individual level, it will cost us more financially. It will cost us security. It will cost us, on a human level, mass preventable harm and death of patients, our loved ones, our family members, our friends. And this is what our government is doing. If we make that case to the public in a way that they understand, like they did with the threat of making a European Super League, they understood that American interests, financial interests, with no concern for football, were going to steal away their beloved pastime and change it into a total corporate cash cow. Well, that is what's happening to the NHS. I know football is important, but I think the NHS is more important. And we need to, between us, get that message out loud and clear that the establishment in this country is selling us all out to foreign corporate interests.
Okay, great. And maybe just finally, you've touched on it there yourself. If the opposition, if we can call it that, from the opposition and other groups is not that great, what is it that ordinary people can do to make their voices heard? I mean, obviously they can write to their MP and so forth. Is there anything else you would advise that they might do?
Well, I think, first of all, get themselves informed, tell as many people as they know, engage in whatever form of public discourse they can do, so anybody can pick up the phone and counter the dominant narrative created by LBC or talk radio. Challenge what's being said, because we're being nudged to act against our best interest. Get onto social media, spread the word. That's the first thing. We need to get the word out. The second thing is start to think how we can affect change. Now, the government quite easily ignores big demos. We saw that over the Iraq War. We have peaceful demos on weekends, not disturbing anyone. We need to take a leaf out of movements like Black Lives Matter, Extinction Rebellion, and do peaceful, non-violent, direct action. And, you know, even consider industrial action if we can get enough union support, because our opposition is non-existent. Our opposition in Parliament is colluding with all of this, as far as I can see.